The countdown to Obamacare continues. Dr. Ben Carson still with me. Doctor, you know, I went out on the street to ask people what they think about Obamacare. Not one person understood it. So how are people this week, when these exchanges are supposed to start on Tuesday, going to know what to do in the first place?
Well, you know, this is symptomatic of government programs. I mean, you look at our tax structure. No one fully understands that either. The government can get anybody on a tax issue. The same thing now with our health care issues, and particularly with the IRS in charge of enforcement. You can imagine the havoc that's going to be wreaked there. And it really tells us we do need health reform. There's no question about that. We spend twice as much as the next closest nation on health care, have horrible access problems and lots of inefficiencies. This is easy to fix. You know, I've got a stack of things on my desk a foot high.
How would you fix it?
Well, first of all, what do you need for good health care? You need a patient and you need a health care provider. Along comes the middleman to facilitate the relationship. Now it has become the primary entity with the patient and the healthcare provider at its beck and call. First you have to fix that. Get the middleman out. How do you do that? Health savings accounts. You give everybody a health savings account. We can do that for far less money than we're spending with CMS. And it can be a very basic healthcare account to which people can add as they please. And by accumulating money, you can buy bridge insurance, you can buy catastrophic insurance. And the nice thing is 80% of encounters between physicians and healthcare providers can be easily taken care of through a health savings account.
You know, doctor, what's interesting is one person on the street said to me, look, you know, my son is a doctor and, you know, he is pulling back on his patients because he just can't do the paperwork. So given something like that, the fact that the majority of Americans are against this, why do you think that the administration refuses to acknowledge that there are problems?
Because what is the most important thing that a person has? It is their health. If the government can gain control of your health, they've got you. And that's why it was so important to push this through first thing when you had complete control of Congress. Twisting arms, doing everything you needed to do in the back rooms, we got to get control of the people's health. Totally antithetical to the founding principles of this nation, where people were, it was supposed to be for of and by the people. You were supposed to have control of your own life. Now the government has insinuated itself into the most important part of your life, and they will continue to insinuate
And as
themselves.
you say, doctor, I mean, with the IRS, which we know has been targeted with going after the political opponents of this administration, if you have to get approval from these people, or if they're involved in this in any way, shape, or form, I mean, that is a frightening thought. But doctor, if the unions are getting waivers, shouldn't the American people be able to do the same?
Yeah, the whole country should get a waiver, a permanent waiver, and we should actually sit down and start working together to come up with something that makes sense for the people.
And you know, what are the people in the medical community saying about this?
Well, a lot of my colleagues are telling me they sure wish that they could retire like I have, that I got out at the right time. You know, I was planning on getting out even before all of this happened. But, you know, a lot of doctors are going into concierge practices, which allows them to work directly with the patients without a lot of middle management in between. And that means that the numbers that are left to take care of the extra 30 or 40 million people, plus the people who are already there, this is going to be unmanageable. We're going to end up with people waiting for long periods of time, not being able to find physicians, just like they do in other socialist countries. Why would we settle for that? And I think it's a wake-up call for the American people. We need to realize that maybe this battle may be lost, but the war is not lost. Not if people wake up right now, realize that there are opportunities to put people into positions of power.
Before we go, do you think the House is going to be able to delay this for a year, the implementation of Obamacare?
Whether they can or not, they certainly should make every effort to do so, because, you know, there are tens of millions of people who didn't vote in the last election because they don't think anybody represents them. You know, sometimes the people who oppose Obamacare go right up to the wall and then they cave. They need somebody who will not cave, and if they know that, they will get behind them, I guarantee you.
All right, Dr. Carson, thanks so much for being with us this evening.
My pleasure, Judge. Thank you.
And